Hello, everyone, and welcome to another Come Sit and Chat with Dr. Clay. So, today we're going to be looking at helping coping in a crisis with kids with special needs. So, again, if any of you, hello Ian, if any of you have any questions during this session, if any of you want to bring up any points or example, hello Carlin, please make sure and ask in the chat area. I apologize if there is any delay to anything, and I also apologize if you see me looking down occasionally during this session because there's a lot of information that I want to make sure I share, and I want to make sure that I address as many of our different labels or identifications of our kids with special needs as possible during this crisis. So, as we all know, we are all dealing with a crisis, not just on a local level, but on many national levels with COVID-19. And it is causing people to go through some really strong emotions and really deep, different, serious reactions. And this is not only happening in adults, it's also happening in kids, and especially with our kids with special needs. So I want you guys to know that as adults express their feelings for the situation that we're in right now, our new normal, as they go through their different reactions, children, all kids are looking at this. But specifically, our children of special needs are looking at our reactions and our emotions as their cue as to how they should feel and how they should react. So many of our kids of special needs, and I'll go down my list. I'm hoping to focus in on children with autism, and I'm reading from my list because I want to make sure kids with learning disabilities, cognitive limitations, behavioral issues and concerns, vision impaired, hearing impaired. If there's a couple of things that I may miss, I apologize, but please do not hesitate to either send me a text or a message or go on to Higher Potential for Learning or Trinidad and Tobago Association of Psychologists, and you will see the list of other psychologists, other colleagues of mine who you can call and ask questions if you're not able to get a direct contact to me immediately so you can get a response. Okay, but there are different resources out there for you to be able to get a response. Hello, Sherry Ann. So this is not just only for individuals with special needs, kids. Many of us have been educators with meaning teaching with kids with special needs, and this information that I'm giving today is going to be helpful even in those instances. Okay, so let's start off with triggers and cues. Everybody has one, and so this is usually what gauges a reaction. Kids with special needs, their triggers and cues could be a facial expression, meaning they're seeing you get serious, and or the sound in your voice, your tone. Kids, hi. Kids, hello, mother. Kids who also they hear a loud sound, or children, they vibe off of your stress and your anxiety. So kids with special needs can be quite intuitive, and they can pick up on those signals. And you, as a caregiver with this child, should be able to recognize when that child's reaction is getting ready to go from 0 to 160. So the biggest thing is you're trying to make sure that you can recognize the cues. It could be a tick, it could be an aggressive spurt of violent behavior, it could be using profanity, it can be shouting. I mean, there's so many different reactions that children have, and our special needs kids and a special needs community, they each are quite unique. So their cues may be different from another child's cues. Okay, so you yourself should be able to recognize your children's cues. And when you know there's a crisis situation, we know sometimes at schools they teach kids, regardless of what level they are developmentally or maturity or age wise, they teach them how to react under certain crisis situations. We need to start teaching our kids how to deal with certain crisis situations. And dealing with COVID-19, you are obviously going to be showing your children every time you go outside or you do something that brings you in contact with somebody or something that you shouldn't have been in contact with, you teach them to immediately go and wash their hands or use their hand sanitizer. You get some of the children accustomed to wearing a mask. This may be difficult with our kids who have sensory sensitivity disorders, and so they may not want things touching their face. So these are things that you would work with the therapist, with the psychologist, or with their medical doctor to be able to help. How are we going to teach this child to be able to transition through and deal with this crisis? For my autistic kids is very difficult. They can be very challenging for their caregivers because we sometimes are not able to gauge what type of verbal or nonverbal information that they are absorbing and what they understand sometimes from what they don't understand. With our autistic kids, you have to be extremely concrete and you would have to utilize sometimes visual aids. When you are explaining a crisis situation, present it in the form of a story with the caregiver that they're accustomed to, with that person being in the story as a character, because you want them to start getting accustomed to when you do your little mini drills of different things that can occur. If you have to go to the grocery store and you cannot leave a special needs child on their own and you have to take the child with you, if that child walks up to someone else, especially during this period in our new normal, you want to make sure that the child does not walk up to a stranger or does not reach out and touch someone, because there are dangers in that. But how we relate that information with my autistic children has to be very careful, because according to where their functioning lies, they can be very, very literal, and everything that you say, they will take it very literal. You have to also remember that their experience with trauma is something that they are constantly bringing forward into their present. So things that you've taught them previously regarding different trauma issues or crisis, like if there's a fire in the house, did you have a routine for that? If they get lost and you separated from your family, was there an actual routine for that as well? Autistic children need their routine and they need things to be as same as possible. If you are choosing to change the environment of an autistic child, please make sure you bring some of the things from their normal environment with you so that they can have as much of the sameness as possible. I'm going to move on to our cognitively limiting children, kids who have cognitive impairments. You have to judge this by where your child falls. If your child falls in an area where they may be 16, 17 years old, but developmentally they are at a child who is 3 or 4 years old, you have to gauge how you explain things according to their comprehension level and their cognitive development. So if pictures are needed, pictures can be utilized. One words or phrases can be utilized. Acting things out can also be used. But you as the caregiver can gauge exactly how much your child can understand, so you'll know what do I need to actually explain and how do I need to explain it. Please make sure you chime in if you need to, any questions, because like I said, I'm going down a specific list. I want to make sure I hit as much as I possibly can. And I am coming from the perspective of the caregiver, meaning the parent. And if possibly something happens to a special needs child and a first responder has to come in that child's presence, they need to recognize that because they are not the child's norm, you may see behavior that could be extremely violent and very aggressive because the child does not know you and you're not part of the picture that they have in their mind of what is normal and safe for them. So you need to recognize that, and that you're not, coming towards them with quick movements, or you're not yelling, or you're using words or possibly pictures, because many of our children would have a picture of who their family is. Maybe there's safe words that the family uses. So if you're able to find out those things as first responders, please do so that you're able to help our special needs kids, and that they don't run in the opposite direction thinking that you are not a safe person. Okay, so again, all of our kids with cognitive limitations, please make sure you explain things at the level that they are. Recognize that they're absorbing information, all the information that they hear. Those of them who are not auditory impaired, make sure that you are cognizant of the things you're saying or the different screens that you have up for children. Many of our special needs kids, as I said before, take things very literal. So when they see pictures of different things happening in the news, they're going to, or they definitely will be interpreting that in their own way. So after you see that your child has seen something, and you know that they've probably just interpreted crazy because they are starting to sweat, or they're starting to hyperventilate, or they're starting to, you see a tick, or they're starting to throw things around. You as the parent should know some of the ways to de-escalate that issue and to calm your child down. Because once they trip off into pretty much the 160 plus, then it's very difficult for you to calm them down. The only thing that you're able to do at that point is to make sure the area that they're in is a safe one. Meaning, if there's any sharp objects around, if there are any chairs, anything that can break, move it out of the way and let them have that time that they need to basically vent and de-escalate themselves. If there's a stuffed animal, if there is anything that you're able to think of that will calm them down, a song, even if it's hugging and rocking, that works with a lot of children. Please, our Caribbean parents, I am not going to stress enough, and to recognize what triggered them. Thank you, CT Cover. Exactly. Know what the trigger was that set them off so that you could prevent that in the future. But if it's already happened and they're already tripping off into that direction, please make sure that you're not responding with violence. I know for many of us, we've grown up into the culture of licks for everything. Well, for our special needs kids, licks does not work. It only escalates the situation, and it's abuse. So if you'd like to have a conversation about that with me at a later date, you may, but not today. So I just want you to know, do not respond with violence. Then we would have our kids with learning disabilities. This is a little bit more common. You would think children with ADHD, dyslexia, dysgraphia, dyscalculia, just to name a few, that you're like, oh, these kids only have maybe, issues with specific skills. They have deficits with skills. Hello, Elliot. And so that might be the only concern that you have. No, I'm sorry to say. Our children who have learning disabilities, they struggle not only with the deficits in their specific skill, but they struggle with being able to manage their own emotions. They are also kids who are into the immediate gratification, and if it's not given to them, you will find that you will have a reaction that may be a little bit more explosive. So they also have trouble with time. So when you're thinking, I just told you, we're not supposed to go outside, or I told you school time is for the next hour to 2 hours. In about 15 minutes, maybe less, they've forgotten exactly what you said, and they pretty much are asking you the same question again. Many of them will get confused with different vocabulary that's being used on the news. They're great at pretending that they understand. They're great at, we could say, faking the funk, so to speak, because they don't want you to know that they're scared or they're upset. But if all of a sudden you see that they're starting to talk back, which is sometimes a little bit more, they're being defiant more. They're starting to be rude and more abusive or aggressive with themselves or with their siblings. Those are different things that you'll see occurring. The disorganization, increases. The ability to be able to stay on task, decreases. So those are different things that you have to be concerned of with our kids with learning disabilities. Please recognize that just because you think that, oh, the only issue they have is a specific skill deficit, remember they have trouble with managing their emotions. They have trouble with being able to verbalize to you exactly how they feel. Hello, Michael, and they have trouble being able to put those feelings into words, especially when they are afraid, especially when they become frustrated or angry. Please recognize that before you react. Take a minute, pause, actually validate and say, I see that right now you're upset about something. And I'm speaking about our kids who are able to communicate, and this is our kids with learning disabilities or LDs. But I see that you're upset. And right now, I just need you to tell me, how can I help? And you don't just want to, how can you help? And if I can't help, then I'm going to just sit right outside this door and I'll be waiting for you when you're ready for me to help. But again, you still got to make sure that they're safe. You still have to make sure that there's nothing that they can hurt themselves with or anyone else. Because just like an adult, when your emotions take over, you don't think straight. You don't make great decisions. So what do you expect children to do when those markers that they need to tell them, calm down, do not exist? That we have to actually teach them how to recognize those things. But during a crisis, all of those lessons sometimes go out the window, and we need to recognize that. Okay? Now we're going to go into our kids who are vision impaired. You have to remember, children who are vision impaired cannot see your facial expressions. They don't know what's going on. All they're hearing is all these strange noises, meaning if you're yelling or if you're screaming, or they're hearing stuff on the news and there's no picture that goes along with it. You need to explain and describe things to our visually impaired. Make sure that you are sharing with them in a description that they're able to understand exactly what's happening. Ask them, do they understand? Check for understanding regularly with children who are visually impaired. Make sure you're checking for understanding as you're explaining, and that you're pausing and giving them time to process, especially with vocabulary. Make sure that you're giving them time to ask, Mommy, what does that word mean? Or what does that look like? Because they can't see it, and they can feel your fear. They may not be able to see it, but they can definitely feel your fear. This is the same as well for our children who are hearing impaired. Hello, Avenel. They cannot hear things that are happening around them, but they can see it. Okay. Some of them have levels of hearing, but many of them will need you to either show a picture. Many of them are able to read, or some of them can read your lips. But if they're not able to read or read your lips, please have pictures for them to see. Where are we supposed to meet? You guys need to have routines in your house for different things that may occur during crises. Because remember, with COVID-19, there are many first responders that may not respond immediately like they did in the past, because their services are being utilized elsewhere for other things. So as families, you should have a plan in place for everything. Any possible thing, especially when you have a child with special needs. How are you getting these kids out of the house? How are you going to reassure the child that they will be safe? Because a hearing and visually impaired child is going to be worried about, well, what if something happens? How am I going to get away? Is somebody going to be here to explain what's going on for me? Because what if they have to leave their home? So we don't know what this new normal is going to turn into. At this moment, they're home. But you need to explain to them that if we have to leave the house, again, if you have to go to the store for essential things, you need to explain to your kids who have special needs what is the expectation when they are outside. Again, you need to explain to your kids with special needs what is the expectation when they are outside, when individuals maybe come to the door, when people come into the house. Because I just recently heard, and I had to mention this, I'm sorry, that in Trinidad there are people that are advertising to come to your home to do your hair and your nails. Ladies, please, I'm sorry, but get over yourself right now. Ladies and gentlemen, if your nails need to be done, you're going to have to paint it on your own. As you can see, mine needs a fill, but I need to just chill. Do your own hair. If someone comes to your home, they are jeopardizing you and your family. And God forbid there's an issue at your home. When they leave, they're taking it to the rest of the world. Please do not allow anyone in your home who is not essential. Even when family members are dropping food off, I have had a few calls on the hotline where people have children with special needs who are living on their own, and they will drop food off at the door for them, or they're calling or talking to them on the phone. These kids are higher functioning. They're able to live on their own, don't get me wrong, but you still have to protect them. So make sure you're explaining at their level of understanding, please, as well as make sure that they know that the steps that are being taken, how the changes are in their new normal, is because you're trying to protect them. It's because we're trying to protect everyone, not just only them. Okay? Now we're into our children who have severe emotional disturbance or behavior disorder. I know many of you may not have had experience with kids like these, but these children are extremely violent. They have serious emotional and behavior problems. In the normal, ideal world that we had previously, before COVID-19, without fear and anxiety, they struggle to still control their anger. Anger management is a serious challenge for our children with emotional disturbance and behavior disorder. So it's even more difficult for them during a crisis situation. Many of these kids have grown up to be adults with the same disorder. So again, as I've said, we have the list of psychologists that you're able to call, the hotline that is free through Trinidad and Tobago Association of Psychologists that I am a member of. And you are going to be able to talk to somebody. And we will then be able to assess from the conversation if we need to put you in contact with someone else that could be more supportive. So I need you to recognize that these individuals may be more prone to instances with abuse to themselves as well as to others, domestic or child abuse, as those situations may grow in this new normal. Also, many of them may struggle with depression and anxiety and suicidal ideation. So we will have more instances of cutting or more instances of Can we have the link again, please? Yes. So the link is going to be Higher Potential for Learning LLC. That's the Facebook. I don't have it where I can just cut and paste it right now, CT cover. I'm sorry, and I don't want to touch anything and mess up the transmission. But I will make sure and post that again in the chat afterwards, if that's okay. Also, Trinidad and Tobago Association of Psychologists. That's TTAP, TTAP.com, I believe it's .com or .org. but it's Trinidad and Tobago Association of Psychologists. You could just type that in and you would be able to get it. We have a plethora of information for you to connect with so that you'd be able to get the support that you need. Okay? Our children who are going through depression and anxiety and self-harm, okay, they should be watched as closely as possible by their caregivers, by their parents, by their spouses, by their friends, whoever is part of, you're welcome, who's part of their support system. You have to remember that all of our kids with special needs are accustomed to a specific routine. They're accustomed to a sameness that is equal to safety for them. And so any change in that, any show of anxiety or any feeling of major stress for them can trigger them into an area of their psychosocial well-being that we don't want them in. It's difficult enough for them to deal with whatever challenges that they have to deal with. When we throw crisis into that, it creates an obstacle course, an emotional obstacle course that many of them are not able to maneuver through. So I will ask each and every person, if there's something you do not understand or your child is exhibiting behavior that is confusing to you and you don't have the tools to be able to cope with it, please call the hotline that is absolutely free. Even the hotlines that we have in the United States for suicide, as well as for anxiety concerning addiction and things like that. Sadly, in the US, we do not have a hotline that is specifically geared towards the stresses and the different psychological impacts of COVID-19. But Trinidad and Tobago does. Trinidad and Tobago, TTAP, does, and we have begun this new hotline initiative to address the psychosocial well-being needs of the people in the Caribbean and definitely as well as in the US. If I am not able to address those needs personally, I will definitely try to find a way to contact and connect you with another professional that is able to support you specifically in your area. So I will make sure and go that extra step. Please try your best to keep the routine as close as possible to the normal for all of our kids with special needs, meaning their lunch is the same time. They still have their favorite clothes that they wear. Try to play games that they enjoy. Show them pictures of their teachers, of their classmates. Show them pictures of family members that they may not be able to see all the time. Show them pictures of them or videos of them if they're able to see that or to hear recordings of their voices. Do these things to reassure them, because remember, when things are out of the ordinary and out of the normal for you, you get anxious, you get upset, you get frustrated. How do you think our children with special needs feel? The same, if not worse. So I need you to be cognizant of those things. Again, if you are in any way confused about what to do for your child who has a special need, please contact TTAP, the hotline, which is absolutely free. No one on this hotline will be charging you for the services that we will be providing as far as support. Please, ladies and gentlemen, across the world, continue to utilize your hand sanitizer. Continue to utilize your hand washing. Please try your best when you go outside for the essentials. For the essentials. That means grocery store for food, pharmacy for any medicine or things like that that you may need. Maybe going to a doctor's visit if your doctor is still accepting patients. Some doctors are, or if you're going to the urgent care clinic to get a test or different things. These are essentials. If you're dropping food off for a parent at the door, staying 6 feet apart, these are things that you are allowed to do. If you're not doing any of those essential activities, please self-isolate, stay indoors. If within your home you are noticing symptoms with one of your family members, have them self-isolate in their room. They cannot come out and be part of the rest of the house. These are different things that you have to do. If you're confused about something, again, ask a question rather than taking it upon yourself to do what you want. This is not just your life that's in your hands. It's all of our lives that's in each of our hands. Please follow the directions and suggestions of keeping healthy. There are many things that you could do in your home. For those of you who are able to go outside and exercise, you can do so, but with a distance, social distancing between the people that you see on the street. I can't stress this enough. I wish that we would be able to continue some more, but we're coming to a close. I have checked off most of the things on my checklist that I have been able to cover. If there is anything about our special needs kids, questions or different things that you feel that I should have mentioned, please send me a messenger through Higher Potential for Learning, or go on to my private messenger, or if you want to send me a text through WhatsApp or regular text through the hotline number, please do so. If there's something that I missed, I'll make sure I post the information on my site, my Facebook site, and I will also ask that TTAP post information on their website as well. We all need to do our part. Please do so. I'm asking you again, self-isolate, wash your hands, protect your family, and social distance. And thank you again for sharing your learning experience with me. I appreciate your time and value it. Good day, and thank you for coming and being part of Come Sit and Chat with Dr. Clay. I'll see you guys next week Tuesday and next week Friday. I don't know yet exactly what the topic is going to be about, but I will be posting that soon. Remember, you can suggest topics or different things that you feel that we need to focus on. Thank you again, and please have a blessed day. Bye.